Hello, everyone, and welcome to this after party from the Out in Business EurOutConference event. And we're going to continue our conversation with Anna Marsden about the economic outlook on COVID. And we have MJ Albanna joining us from Kuwait, who's going to pitch in from the healthcare perspective, being the best heart surgeon in the land. So,
Thank you, Sam.
Dr. Albanna, thank you for coming onto the call. And Anna, let's start with you. How are you? And how was that? And how and that is so representative of how things have gone over the 6 months, isn't it?
For those of you watching this who've got no context, Stephanie literally zoomed me in via her mobile phone to the video presentation we should have been doing, and I think the tale of that is determination to make sure that you never give up. Stephanie was really very willing to have me as a participant, and I think you're right. It's from my SME business owner point of view, it's really important that you have resilience. And I do some trainings for the British Library at the moment, helping startups in London. And we talk about the values and the attributes that you have as a business owner. And resilience and the idea and notion that you keep on going is definitely one of those fundamental ones. So I feel like we did that today. And in the terms of COVID, you have to be agile, you have to be prepared for the unexpected. Although whenever there's technology, you're always slightly expecting that it won't work. Even if you don't necessarily have a plan, you're always expecting that it won't work. But yeah.
It adds a layer of tension. But before we started this call, you and MJ were talking about zero profit businesses and how businesses are really struggling to make money and how they don't plan for zero.
Yeah. Well, so we were talking about cash flow. So zero profit, maybe not, but zero cash flow. Yeah. So I was saying to MJ, in April this year, like many small businesses, April came and no money came. Zero revenue, zero money. And so MJ was saying, how do you plan for that? You don't plan for nothing coming in, because all the while you have expenditures going out. So we were talking about cash flow and the importance of that. And I was saying, I'm a digital agency. We help professional services with their communications. We help target their audiences, create quality content. I'm a trainer. I love training and helping other people figure it out so they can go do it themselves. But as a business owner, I have to do it myself too. And if you don't have a good idea of how much you need every month, and if you don't have some savings and reserves for those times when potentially no money comes in, it's impossible to run a business. So yeah, we were talking about cash flow. Most digital agencies don't have 3 to 6 months worth of money in savings. And I think that you need that. You need to be quite conservative, I think, with your money, because it doesn't always come, as we've seen.
How did you deal with it, Anna? I mean, every business owner I know, I guess I've asked every business owner I know, did you have to go through layoffs? And how did you deal with the no revenue?
Yeah.
How did you deal with it?
Yeah. We're really lucky in many, many, many ways. And one of the ways was 8 years ago, we started our business and it was remote by design. So we don't have a big office. We don't have lots of staff. We have subcontractors. We work with our clients on project-based work. So we'll pull a team of experts around an issue, a project, and we'll work like that. So throughout the 8 years, we haven't had massive overheads. We have concertinaed. So we've had times where we've had lots of subcontractors, lots of money coming in, lots of work. And then we've had other periods of time when we've contracted. So we knew we were able to do that concertinaing. And for me, that was really helpful, because on an emotional level as a business owner, I want to know I've got it covered in as much as I can, even though you can't plan for zero revenue. So what we did was, so lucky on many, many points. Another point of luck was that our business, so I work with my wife and I set the business up, Luminescence, 8 years ago. at the beginning of the year, we decided, let's take a little sidestep. We've lost the joy a bit. We've lost the, you know, what we're doing it for. I had a big birthday last year. What's it all for, kind of thing. So I was having a personal kind of debate. My wife's just turned 40, so she's also now having that inner debate. So we'd already kind of taken the foot off the gas, thinking that we were going to have a maybe a bit more of a professional development year, trying to think about what we wanted to do, where were we best placed to give value to our clients, rather than you get into a rut because it makes you money. But actually, is this where we're doing the best work? Is this where we're most passionate? Is this where we're most bold and how we can learn more and help our clients learn? So that was kind of when the pandemic hit. So we'd already shrunk down, we'd already concertinaed. And another point of luck is within our business, we're not just focused on digital campaigns, marketing campaigns, written content. We also have a training arm, and for a content marketing agency, that's quite rare to have a training arm as well. So what happened was all the money from advertising and marketing went, all our PR retainers went, but we still had training. And so what we did very quickly, and I feel like I've been wearing my Madonna mic, my gaming headset for 8 months because I have, I quickly looked out and sought out every single opportunity to do and deliver training online. So I couldn't do the face-to-face stuff. So we pivoted and we used my experience as a trainer, nearly 20 years worth of experience as a trainer. And I focused on really developing different topics within my training. Sometimes it is digital marketing. But as I said at the beginning of the call, I'm working with the British Library and the Royal Academy of Engineers at the moment with their fellowship work, their startup work. So helping other growing startup businesses figure out the landscape. And I get so much joy out of that. I love it. And 8 years in with our business, I love to pass that knowledge on. So the training was something that saved us. And then very quickly, May wasn't a zero month, which was great. So that's how we did it. I don't know how other people do it if you don't have a diverse offering.
That's fantastic. But you know, since you guys shifted to a virtual existence by choice 8 years ago,
Yeah.
what would you tell bosses, business owners who are doing it now by force,
Mm-hmm.
and because COVID is making them become a virtual enterprise? How can they deal with it? You know, people say you cannot replace the water cooler moment, bumping into a fellow colleague, talking about things, and you know, how can you replicate these things? How can you manage your people in a virtual existence?
Yeah, I think that's a really good question. And again, we've got a slightly different relationship with the people that we work with, because they're not our employees, they're subcontractors, they're peers that help us deliver on a project. So when we're working with people, you have to have structure, you have to have tools that will help you do the work. So my advice initially would be, don't go with the tool because someone else has told you you need it. Put your people first. What do your people need to be able to do? What do your people need to be able to hear? What do they need to be able to feel? Really think about your main asset, which is the people in your business. And then try to look at how tools can facilitate them to do their jobs, rather than this is the suite of tools that we've been told to buy. This is how you're going to use it, because we all know you can't just implement IT onto people. You have to think of how people use IT and vice versa. So I would say try and be as bold as possible to question quite critically, how will we use this tool in the organization that we have with the people we have? How can we make that work? Would be my first kind of question.
On a separate note, Anna, at the end of the last interview, when I asked all of the panelists for...
I shocked you because you went, oh!
Your top, I asked the panelists, what is your top tip for surviving lockdown? And you said, just be kind to yourself and you don't need to come out as a better person. What on earth do you mean by that?
And that's interesting because someone else on the panel said, you can do all these things and do. I think we put so much pressure on ourselves. And especially as someone that has run my own business for 8 years, you're under pressure all the time. So don't put more pressure on yourself. Don't think of this time when we're working from home that it's the opportunity for you to learn a different language, learn a skill you've never had, hone a hobby you've never cared about, be able to cook something you've never cooked before, be a brilliant baker. All these things, unless you've got the passion to do them, and just because you have the time doesn't necessarily mean you'll have the inclination. So I guess what I mean is, don't feel like you have to build a better person that's with new skills and new hobbies. Just kind of having the time to think about. And again, I'm in a very lucky situation that I can even talk like this, but what brings you joy? Where do you want to go with your work? Where do you want to go with your relationships? How can you make an impact? Rather than trying to build a new sense of yourself, I think there's a lot of pressure that we're putting on ourselves to be better people, when actually we're living through a global pandemic. People are dying, people are losing their livelihoods. Don't put pressure on yourself to be a better person. Just try and be kind, I would say.
I like that too. You know,
I like it. I like it as well. That's great advice.
it's healthier. And
Yeah, I think so.
and the health
And our mental health is going through, our ill mental health is going through the roof. I was talking to a colleague of mine the other day. I can't remember the reference, I'm sorry. But she said she was reading something, and 100% of us will have some sort of mental health impact because of this. So we have to be kind to ourselves, because we take that, for people who've not had poor mental health, we take it for granted that we'll be okay. And we shouldn't.
Yeah, we shouldn't. And also, I think we're not expecting us to not cope. Therefore, we're not as self-aware as we're not being vigilant. So we think we're fine and we think everybody else is the one who's suffering from COVID. Well, we're all in this together and we're all suffering equally. But I want to move to the healthcare sector, MJ, if I may ask you a question.
Sure, absolutely.
Well, a lot of healthcare professionals are under a lot of pressure right now who are helping COVID patients, but there are a lot of healthcare professionals who are not, who have either lost their private practice, or because of the contact involved in the type of medicine that they practice has made it impossible for them to operate in the last 6 months, sometimes literally operate. So, you know, so many doctors, how has it affected the private practitioners, the ones that work for the government, ones that travel perhaps? What's going on?
Well, the group who has been affected the most, I would say, by the pandemic are surgeons, and I'm one of the surgeons, and we've had to kind of put our priorities on standby and on hold, and allow the frontline workers to take priority, take precedence. They take all the beds, take all the ICU beds, take use of all the ventilators, and we've kind of had to come in the second place. Obviously, I'm not saying that it should be otherwise, because the number one priority at this time is to look after patients who are suffering of the COVID infections. And the other thing that has happened is that private practices and people who are dependent on their private practices, who are in essence their business owners, have also been affected, and their livelihood has been affected. And you know, just like Anna and anyone else, their income has shrunk, and they've had to deal with these problems. When you go through medical school, you're not really taught or told that a time would come when your practice is going to be shrunken and you won't have business. If anything, this is one of the, people never stop getting ill. Unfortunately, we as physicians, we would like people not to become ill, but it's a matter of life and fact that people continue to become unwell. And even these private practices and patients' reluctance to leave their homes, go to hospitals and clinics where there's lots of people, And there is lots of illness and infection, and people are also reluctant to go to these places. So we've had to face a new reality that we've not had to face in the past, but trying to be resilient and trying to cope with whatever life throws at us. We're all quite, what should I say, optimistic with the news that vaccines are on the way. Many of the, what should I say, public, non-medical people are cautious and afraid of taking the vaccine because of side effects. I would say 99% of my physician friends are happy that a vaccine is on the horizon, and they would not be reluctant to take a vaccine whenever it's available.
I'll stay with you, MJ, and I'll come to Anna in a moment and ask you how you've had to develop content and PR campaigns for your business owners so that they can connect more effectively with their overstimulated and over-text clients right now who are being bombarded with email. But MJ, how have you connected with your audience, with your Instagram following? How many followers do you have now?
So I have about 120,000, 60 on Facebook and 60 on Instagram, but they're all Facebook, really. They all belong to the same company. Having said that, so what I did is I stopped posting anything. I'm a heart surgeon. I normally post about heart disease. And in February, March, and April, I thought this is not the time to talk about heart disease. This is the time to let people aware and know about the virus, what's happening with the virus. And some of my physician friends have kind of championed the campaign to spread awareness about the virus, the latest studies. It was a new disease. We didn't know anything about it, and there were many studies coming out and papers to describe how it's spread, describe the symptoms, describe the consequences and the complications. After some time, you find that people are COVID fatigued. They don't want to hear about COVID anymore. They want to hear about anything but COVID. And that is the time, I think, when...
and I think I just go with that, because I think it's easier for us. And I was just listening.
Being interrupted by education, I think. So whilst you resolve that, MJ, Anna, so back to the idea of this fatigue. So Zoom fatigue, COVID fatigue, email fatigue, receiving more emails than we would normally receive. So normally email campaigns have a certain hit rate, and now you do the same actions and it's not as effective, both because your offering has changed, but also the audience's attention has changed. How are we getting engagement anymore?
That's a really good question. I think what MJ was saying about the types of content that he was posting for his followers is really interesting, because one of the, and I think I said this in the other presentation, the main kind of definitions of content marketing. So the content marketing is all about lead generation. It's about, lead magnets. Who can be interested by this content to help them do something that's profitable for your business? We're not just creating content to make people happy. It could by a byproduct, but the definition within the Content Marketing Institute is that it should be of value to your targeted audience. Those audiences should do some sort of action that will be profitable for your business or engaging with your business or charity. It must be valuable, relevant. So at the time, you need to be quick to change the key messages or the content of your content to make it relevant to the lives of the target audience you're talking to. And then consistent. So if you're regularly posting, people know to come back to you, people know to look out for you. So that positive kind of value, relevance, and consistency is the key to good content marketing. what we're finding in a global pandemic is the context is changing, and so therefore the value will be changing for your targets. So we need to really think about our tone. We need to think about the so what test. So what? So what? So what? Is it important in the grand scale of things? Because this fundamentally is life-changing for many of us. And so I think we need to be quizzing ourselves about the value and the relevance of our content. Coming back to how can we get people to actually do the stuff we want them to do through content marketing, it comes back to what I said in the previous presentation, knowing your audience, knowing what is going on for them, knowing what they're wanting in terms of value, knowing what their problems are, their barriers, what would be a gain for them. So I take my British Library startup cohorts through a value proposition, a really simple value proposition. Who is it that you're speaking to? What are they doing in that moment? Or what are they interested in that potentially you can give them? What's a pain for them? So what's an issue or barrier? And then what's a gain? What would make it even better once you've delivered against that pain reliever? And we go through these kind of templated exercises to help us start to think about work and life and business isn't necessarily about what we want to push onto other people. It's about serving the client and the customer. So coming back to in this period of time when we're in COVID, the worst thing you can do, and I've seen it so often in LinkedIn over these past few months, is say, I want to connect with you. And then the next thing you hear is a hard sales push, or I, me, we. There's nothing about me there. I mean, the audience member, the target. You need to be really clear about the value that you're giving a specific person. So I don't think a lot has changed. We just need to be a bit more sensitive about the context, I think.
Yeah, absolutely. You need to tune in to this customer and what do they want? What do they need? How can I position this? At the same time, it's so hard to know what clients need right now to understand if what you're doing is still relevant, or if it's relevant but at a different price point or associated with another package. So if we take an example, maybe you have a case study that's been your favorite during lockdown, where you've taken them from not connecting and not making sales to perhaps making sales, just so that people in the audience who have businesses can identify with tips and tricks that they can do in order to start connecting. I think it's so hard for me, even as a business owner, to identify what is it that customers want. Do they want to back off this for a moment, or do they want to invest but lower amounts, or do they want to go online? But it's just difficult to read, and I don't have enough data analytics to get that information. But
and you said they're data analytics. Absolutely. I just finished a course that was working with a charity that I work with. I've worked with them for about 7 years. They're an LGBT plus organization here in Cambridge, where I'm based. And it was some catalyst funding that helped us step back and ask questions, find out and discover what our target audiences wanted and what they thought. It allowed us time to ask the questions. And I think whether it's market research, whether it's reports, whether it's conferences like this, you need to go to find the insights, and you need to ask your proxies, if not your clients, what their, not as obvious as this, what their pains are, what their barriers are.
Interesting. And I never managed to ask you in the previous interview who are going to be the winners and who are going to be the losers of the COVID pandemic.
I'm mindful I was going to chop MJ off. He was just about to say something.
Yes, yeah, I was about to say, do you think that using social media outlets is a way to gauge what your customers want? Because I find it useful just reading their comments. Because audiences nowadays are not shy, voicing their opinions and voicing their wants and likes and dislikes on the different social media outlets. The only time I wonder whether I should listen or not is, sometimes some groups and some people are louder than others, and whether if I listen to what is posted, whether I'd be ignoring a big majority that is silent.
I think you're right. You've got over 120,000 followers, they will give you information. You'll be able to look at, even if you're just looking at their actions, what they've clicked on, you can also ask them about, you know, their feelings about certain issues, trends, products. That's a value. They're really valuable to you, so that you can learn from them about the types of languages, the types of words, the language that they're using around a certain service. So I think absolutely, absolutely you can. And that's a big reason why I'd want to build a big social media following, is because you can make sure that you're speaking to your audience in a way that they want to be spoken to. Stephanie, coming back to your question, what was it about the winners and losers in terms of industries? So definitely IT software, big winner. Any kind of online e-commerce has really massively jumped over this period, because people are being forced to go on to selling their products online. I think surprisingly, maybe, I don't know, maybe their time was come already, but we're not going out to the newsagents. We're not going to buy actual papers. 10% of the UK journalists are going to be sacked. 10% within COVID. So we're losing. And again, looking at overseas, looking transatlantically overseas, the importance of actual news. I'm fearful if we don't have a well-funded media, that what does that mean for us in terms of what we know? So that's something that I think is mindful to think about in terms of the losers of COVID. If we're not going to the local newsagents pick up the paper, then where are we getting our news from? If we're losing journalists, then who are those being replaced by? AI, algorithmic, here's a press release that's been pushed to us. I don't know whether that is something that we should be mindful of. I think it is. The winners, like I say, and this complements the losing part of the media, online publishers. If they have got to their audience and they've engaged them online, then they're definite winners. But definitely in this country, we're not big fans of paying for news. So I think that's an area of interest. I'm not sure whether COVID has sped up that transition. I think it has for some.
Well, thank you very much for joining us today. Are there any final parting words from anyone? Any tips?
I want to thank you, Stephanie, for organizing this, and I want to thank Anna for for her amazing and insightful tips. I truly enjoyed the original chat and the original talk, and I enjoyed being here on this backstage talk. Thank you so much, both of you.
Thank you, MJ. And I would say exactly the same thing, Stephanie. This the exclusive backstage conversation has been brilliant. Thank you so much.
I've loved it very much. So Anna Marsden from Luminescence, weareluminescence.com, and Dr. MJ from Kuwait. And you can find him, MJ Albanna, on Instagram. Yes. Thank you both for coming, and have a good holiday season.
Thank you so much. And Stephanie, go enjoy your birthday.